Hey everybody, it's Miles here, and today is November 15th, 2016. I'm officially 20 weeks on testosterone. I just took my 21st shot. Yesterday I had my top surgery consultation. Everything went really great. I'm totally stoked. The surgeon was really awesome. She made me feel very comfortable, and she made me feel like a person. She's at Legacy in Oregon. Her name is Dr. Tacker, and I've seen some of her results on a person that he has kind of the similar body type as me, and he looks really good. And so I'm excited because I got to see like somebody who looks like me from Dr. Tacker. And she showed me some other photos of other patients and basically told me that I'm healthy. I don't really have any breast tissue left. It's all just fat. So that's good because they want your breast tissue gone before they do the surgery, or most of it at least. She put in for the surgery to my insurance, and said it typically takes them about a month to respond, but she doesn't see any reason why they should deny it. My letter from my therapist was great. It had everything that was needed, and so once the insurance approves it, then that means that we can schedule for actual surgery. I know, crazy. Try not to get too excited until the insurance approves it and the surgery is scheduled. And basically what that's gonna take is hopefully only like 2 months or so. So I'm hopeful that in the beginning of January I'll be able to get top surgery. I'm so happy about that. I have two different choices to choose from. There's the double incision, which is the most common one with the nipple grafts, and that's, if anyone's familiar, that's probably the most common one that you would see from most trans guys. Basically, it leaves you with a really flat chest. They take your nipples off and then graft them back on. Takes longer to heal with those, and she said about 50% of patients that do that surgery need a revision. So that's kind of shitty, but at the same time, like, I mean, what can you expect? So, you know, at least it's all up front there. And that one, you also lose all sensation in the nipples. The other one that I was a candidate for it's called the Anchor, something, the Wise Anchor, or something like that. And that one, basically they take less of the fat, so you're left with a little bit of a moob. And they don't remove the nipples, they just kind of shrink them. And it would look a little more natural for someone my size. And typically you get to retain nipple sensation with the Anchor surgery. The only thing with that is, and less heal time. The only thing with that is I plan to lose weight, and she said people who get that and then lose weight, it kind of leaves them with like flaps. So I definitely don't want to have flappy chest syndrome. If at all possible. Although, I mean, nipple sensation would be nice, but it's not like a top priority of mine. So I think I'm gonna go with the double incision. I haven't 100% made my mind up yet, but that is looking to be the case for me. I mean, but then again, I'm thinking about it, well, if there's a 50% chance that I would need a revision with the double incision, I mean, if I lose a bunch of weight with the anchor, then I would need a revision anyway. So maybe I'll ask her about that. The other thing with the anchor is, since they don't take the nipples off, they just shrink them, I feel like they still kind of look a little bit more feminine. So that's the other thing. But I guess this is good that I'm talking it out on this vlog here, because it makes me think of other questions. So totally stoked about that, and hopeful that my insurance will just approve it right away and won't take as long. As far as stuff with tea, I noticed a couple things this week. Specifically, I'm getting a lot greasier, which is really annoying. I'm trying to keep my face clean. But I've noticed, like, being greasy, like, on my chest, which it's never been that way before. And I'm getting pimples, which I guess you can't really see, but it's really frustrating me. The other thing that I noticed is my pee smell has drastically changed this last week. I thought that I was going to be lucky to not get that nasty boy pee smell, but yet here it is. So, it's one thing that I've noticed that's not the greatest, and I'm not, like, super stoked about it, but, you know, you take the good with the bad, of course, and, I mean, it's not, like, life-altering or anything. And I've noticed my hair is starting to come in much thicker. I also haven't shaved it all this month, so it's starting to come in. I mean, yeah, you can't really see it except for my sideburns, but also getting a happy trail more on my chest. I'm sure I'm getting more on my back. I know I have more on my butt. Fun. And my upper thighs. Other than that, I think probably just like my voice continuing to get deeper. Getting sirred more in public and over the phone. I went to a focus group this week, and I was really nervous about it, but everyone just, you know, respected me, called me Miles. I even got a thank you, sir. So that's good. I guess I'm passing more. I'm just feeling a lot more self-conscious, because I feel like I don't necessarily pass, and I definitely don't pass for being 30-year-old man. But I'm just hoping that the scruff comes in a little bit more and I can feel a little less self-conscious. Also, I had some really difficult stuff happen this week. Sorry this video is so long, but currently about 4 months broken up with my ex. We're still living together. We are trying to be friends. It's awkward and it's difficult, but it seems to be working okay. I don't want to go into details on here, really, because of what's happening, but yeah, something went down with my ex, and it caused a big division in our friendship, and it's been really a lot harder the past few days, and I am trying to deal with it. I'm sure she's trying to deal with it, and trying to heal up. But yeah, so I know that doesn't really tell you much, but yeah, I don't know. This video has already been longer than I wanted it to be. But good news, bad news, living life, 20 weeks on testosterone. So I would want to say that's like 5 months, but technically I still have like 2 more weeks until 5 months, because for some reason we say 4 weeks is a month, which is only 28 days. But anyway, sorry, I got an itch. I hope that you all are taking care of yourself, and the holidays are coming up pretty soon, Thanksgiving, and I hope that you can find something to be thankful for. I know I have a lot to be thankful for, even with the hard times, and, oh, I'm really thankful for a lot of my friends right now. They are pulling together to help me get some funds so I can get my birth certificate updated and hopefully my passport before Trump comes into presidency, just in case. And I don't want to have documents that say male and documents that say female. So I'm hoping that within the next couple of days I'll be able to get my birth certificate and then my passport fairly soon after that. But I hope that you all take care, and sending peace and love to everyone. And I guess this is Miles signing out. Peace and love. Change it up a little. Take care.